A fresh debate this evening about the falling birth rate in Jamaica. Health Minister Dr. Christopher Tufton has announced plans to form a task force to help fix the problem. Details in this report.
Jamaicans are not having as many children as before, and the numbers tell the tale. The country's fertility rate is 1.3 child per woman. The acceptable replacement rate is 2.1.
This has several implications apart from the economic issues around workforce. Social support system are compromised. Consequences include aging population, rising dependency, reduced domestic economic activity, shrinking human capital.
The implications for the future of the country are real. So the state has encouraged Jamaicans to have more children.
And I know that I've been accused of telling people to go and have children, but that's not really what I said. I may be encouraging it, but there are conditions. There are conditions, right?
A spanner in the works in the birth rate discussion is misattributed fatherhood, known in Jamaica as jacket.
The truth is, if you're going to live it up, you must also own it up. Yes. And I think there needs to be a conversation around paternity issues in our country at this time, because it has implications for the quality of family and community, and also to ensure that there's greater harmony at that level, Madam Speaker.
Local research suggests 1 in 4 cases may involve misattributed fatherhood. Simply put, many potential partners in Jamaica do not trust each other to have children together.
Together, these dynamics point not just to fewer births, but to deeper challenges around trust, family formation, and the social conditions that shape decisions about having and raising children. Now, this is not... The public health implications of misattributed fatherhood are significant, just to be clear. And I could give many other implications, but, effects on identity, emotional security, family medical history, mental health issues. The research is very clear that this is something that we should not encourage.
Consideration will be given to establish a high-level task force to help fix the issues around fertility and family.
But I believe the time has come for a conversation at the level of communities and families. The consultation with the Minister of Labour and Social Security, we propose a multi-stakeholder national task force on fertility and responsible parenting, drawing membership from health, labour, finance, education, the private sector, academia and civil society. And the task force will produce a national fertility and family support strategy with clear targets, Madam Speaker.
Internationally, many measures are used to encourage families to make children, including financial support for new parents.
The government is not asking Jamaicans to have children for statistical reasons. It is committed to building conditions where family formation is genuinely affordable, structurally supported and celebrated. The intention is to pursue this initiative to affirm that this government continues to believe that family remains the foundation of the nation's future, Madam Speaker.
Hal Shane Burke, TVJ News.